Good afternoon, everyone. This is Desiree Whalen with the Whalen Team, and thank you for taking some time to look at this really good topic. I know it's not about real estate, but at some point, everybody will be on Medicare, and so it is important to me. It's important for me that you are up to date with what is going on. And last year, we had the Retirement Resource Group come in. They did a great job and talking about Medicare, how it works, how it might fit into your situation, and all the different supplements, maybe some changes from this coming year coming up and what to look out for. The presenter today is Greg Botte.
Bot,
And
yeah, bot,
bot,
B-O-T, bot.
sorry,
That's
sorry,
all right.
bot. I was playing with that whether it was going to go boat or bot, and I should
Yeah,
have asked
it's
you
okay.
beforehand. My fault, my fault.
No, it's fine.
So Greg, why don't you go ahead and get started with your
Okay.
presentation? And thank you for being here today.
Yep, absolutely, guys. And good afternoon, everybody. I want everybody, to take a deep breath. I know this stuff can be quite confusing. My job today is really just to make it easy for you guys. The purpose of this presentation is to give you the information you need so when you do go on Medicare, you can make the right decisions. Like Desiree said, my name is Greg Botte. I'm with the Retirement Resource Group. I've been helping people with Medicare for years. I'm originally from Long Island, New York. I don't know if anybody else is from up north as well, but we moved down here, me and my family, we've relocated to Wilmington. Just, a lot of things changed over the last couple of years, with the pandemic in New York. So we've been down here for almost 3 full years. And, really, I'm a financial guy at heart. I was on Wall Street for 20 something years. My job there was really just to analyze charts, graphs, and really find the right trades to make sense. And that's really what I'm going to try and do with you guys as well today. I'm going to try and make sense on the Medicare, make things as easy and painless as we possibly can, and kind of just make sure everybody's on the right track to make the right decisions. Also, too, if you guys want the slides, you know, we did add in an evaluation form. I don't know if Desiree or Lee sent it out to you guys, but if you guys want the slides, you can fill out your email. I can send you out the slides. Don't worry, we're not going to solicit you guys. We're just going to send you the information and that's it. I'm going to look to approach you guys the same way I would want to be approached. So basically, like I said, I mean, before we get started, does anybody have any questions? No? Okay. Making it easy. Okay. So just before we get started, I mean, people always ask me what I do. Today we're going to focus on the Medicare expenses, which is Medicare. We do help people with long-term care, final expense, like life insurance, and also retirement income. We do a lot of growth where there's no, market exposure. So you don't have any risk of any downsides, or if people are looking for other ways of a stream of income, we can help them with that as well. But today, like I said, we're going to talk about the Medicare. Let me just make sure that I got there. Okay. So today we're going to talk about the Medicare basics, Medicare changes from last year to this year, the overall view of Medicare Advantage plans, some big changes in prescription drug benefits, and the program evaluation forms. And I'm going to try and get you guys out of here in 30 minutes. Okay, maybe a little bit sooner. Okay, so the basic facts of Medicare. It's a health insurance program for people 65 years of age and older. Some people with disabilities like renal disease, end-stage renal disease, I mean. It's administered by the CMS nationally, which is the Center for Medicare and Medicaid Services. So what that means is any doctor who accepts Medicare in the United States, you can get the care done. Okay, it was signed into law by President Johnson back in 1965, so it's been around for a while. Enrollment is through Social Security Administration or the Railroad Retirement Board. Now, a couple of things I want you guys to know. If you're not collecting Social Security at the time you turn 65, you will not be automatically enrolled into Medicare. Okay, this is something that you're going to have to be proactive and enroll yourself. You're going to have to establish what's called a My Social Security account, which you will need to set up an account and a login number. So you can see on the bottom, My Social Security account. You can go to www.ssa.gov. That's where you're going to have to sign up. Now, if you are collecting Social Security, you're going to be automatically enrolled and your premium will come out of your Social Security automatically every month. What happens if you're not collecting Social Security? They're going to send you a bill every quarter. Okay, just to let everybody know. And if it's something that you're not, this is something we can talk about later, go over further on. All right. So Medicare is the largest payer for healthcare in the United States. Medicare represents over 3.9% of the GDP, which is the gross domestic product. Medicare covers over 70 million individuals. The program costs $592 billion in 2014. Costs exceeded $1.2 trillion last year. Now, I don't put that up there to scare you guys, but a lot of people have concerns of whether or not Medicare is going to be around in a couple of years. You guys agree? Yeah, okay. Well, look, we don't think you guys have anything to worry about. Two reasons why. The first thing is, if you're on Medicare and they're going to make any changes, you're going to be grandfathered in. They usually don't take programs away from people who are already receiving them. And number two, do you guys know what generation you guys are? You guys are the baby boomers. Do you know how many of you there are? There's over 72 million of you guys. By the time you all age into Medicare over the next 5 years, there's going to be over 120 million seniors on Medicare. Okay, that's 120 million voting seniors. So that's like half the voting population. So we don't see them taking your Medicare away. I mean, they might make some changes to the next generation, but as far as you guys, we don't see that going anywhere anytime soon. Okay, and there's nothing in the pipeline telling us anything different. So I think overall, you guys have nothing to worry about. All right, now the next one, this is the sheet, probably the second most important thing I would say. This is really gonna kind of let people understand what Medicare is, what's the difference. I did give Lee this form as well. Some people, if you want to write it down, people tend to, memorize or will kind of take it in a little bit better, writing things down than just hearing something. So if you do have this form, it is blank. You can definitely fill it in. We'll go over this right now. On the left side is the original Medicare. Okay, this is the Medicare you think of when people say Medicare. It's your Part A and your white and blue card. Part A is your hospital coverage. Anytime you go into the hospital, it falls under Part A. Okay. Part B is your medical expenses like doctor visits, primary care. This coverage has been around since 1965, and it was never designed to cover everything. And that's why Medigap or supplements were designed to fill in those gaps, to fill in the holes that are there. Okay. And now on the right side, this is where some people get confused. This is the modernized Medicare. This was a result of the Balanced Budget Act of 1997, where Medicare and Congress came together to try and save money. So they outsourced it to a private insurance companies and introduced Medicare Advantage, or Part C, which replaced your Part A and your Part B. And the idea was for Medicare to save enough money to introduce a prescription drug plan, which is Part D. Before this, there was no drug plans. So there's really 4 parts to Medicare. Okay, there's Part A, there's Part B, Part C, and Part D. And how they work is very simple. You can have a Part A, a Part B, a Part D with a supplement, or you could have a C and a D, but you can't have A, B, and C. Reason why is because they're not the same, but they're similar. Okay. There's fundamental differences. Under original Medicare, your claims are paid by the government. Okay. So if your doctor codes it right and files it right, Medicare will pay the claim. Now, with Part C, your plans are usually under an HMO or a PPO. With an HMO, you have to be in a network, okay? With a PPO, you can go in and out of the network, but they are local and regional. So if you go out of the area, they are less likely to pay. Um, and also too, these are private companies with shareholders, so they have to be profitable. So they will take into consideration more than medical reasons on whether or not your claims were paid. And this is something that we'll go into a little bit deeper. Okay. Now, the original Medicare plan, um, you may go to any provider that accepts Medicare. Is that a big deal? Absolutely. Not all doctors accept Medicare. So you need to make sure that your doctor accepts Medicare. Okay, now if you don't have a doctor, definitely find one because it's easier because it's easier to be accepted once you're a current patient that ages into Medicare than somebody who goes and ages into Medicare and doesn't have a doctor and then needs to find one. Okay, because some doctors aren't taking on patients. Some of them aren't going to take Medicare patients. So, like I said, if you don't have a doctor, find one now before you age into Medicare because it's going to be being a current patient is going to be a lot easier. Part A, it is premium free for anybody who worked 40 quarters or 10 years. If you didn't work that many quarters, let me know. It's something we can talk about later. Part B has a premium of $185 for most people, but if you are one of the fortunate individuals who make over $106,000 a year or $212,000 as a couple, and that's adjusted gross income, you're going to have to pay what's called an IRMA. Okay, that's an income related monthly adjustment amount. And they're going to look back for 2 years. So if you're turning 65 this year, they're going to look back at 2023. If you're turning 65 next year, 2026, they're going to look back at 2024. And like I said, this is something that, everybody's there for, something we can talk about as well. Also, if you cashed out of like a 401k, a retirement fund, an IRA, and you inflated your income for that year, you can appeal it, but there's no guarantees that they're gonna approve it. Okay, just things to know. So 185 is just for people that aren't making over 106. You start making more money, that 185 is going to go even higher depending on your threshold of how much money you make. Okay. Part B. Now, Medicare Part A benefits, hospital stays, skilled nursing facilities, home health care, hospice care, and blood. Paying for hospital stays. Now, for each benefit period you pay, it's $1,676 deductible for hospital stays from 1 to 60 days. Now, this is not an annual bill. This is per illness for every 60 days. So what that means is that if you go into the hospital, you come out and you go back in and it's been longer than 60 days, you're going to pay another deductible. It's going to be another $1,676. Now, any days above 60 days from 61 to 90, you're going to pay $419 per day. From 91 to 150 days, you're going to pay $838 per day. But understandably, you do have a lifetime of 60-day reserves, meaning that you can use them whenever you want. But once you use those 60 days, you never get them back. Okay. So after beyond 150 days, you're going to be paying everything. Okay. Because like I said, they don't take care of long-term care. It's just Medicare doesn't pay for it. Okay, so skilled nursing facilities coverage in the first 40 days after a minimum of 3 qualifying hospital days. So after you're in the hospital for 3 full days, they're going to cover the first 20 days. Anything after that, you're going to pay $209.50 per day. For days from 21 to 100, you pay for all costs after 100 days. Does not include custodial care. They don't pay for that. They're not going to pay for that or long-term care. Okay, so skilled home health care covered services, part-time skilled nursing care, pain and drug management, therapy, occupational, physical, speech, language, some health aid services, and durable medical equipment. That's considered DME for us in the industry. And what that is basically like a wheelchair, hospital bed, or even walkers. Okay. Paying for home health care. You're going to pay pretty much everything. Nothing's covered from home health, nothing for home health care services. 20% of Medicare approved amount for covered durable medical equipment. Just like you need a doctor that accepts Medicare, you need to find a company for durable medical equipment that accepts Medicare as well. Okay. Custodial for you pay for custodial care, full-time nursing, for homemaker services, for delivered meals and transportations, and that's pretty much part A. So hopefully that wasn't too painful. Okay, so now part B. Now, by the time I'm done with part B, you're going to pretty much know everything you need to know, even more than Bill. You know, Bill, the guy who lives down the street from you, who's the Medicare expert in your neighborhood. He's got the best plan in America. He gets all the free stuff, and you have to get the same exact plan that he has. I'm sure you guys know people that tell you, "Hey, look, I know everything. This is what you need to do." Do yourself a favor. Don't listen to them. Please don't listen to them. Because first, two reasons. Number one, their situation, Bill's situation, might be totally different than yours. And if you get the information, he can mess you up and mess you up permanently. And there's nothing you can do to Bill. I mean, you can, by giving you bad advice, I mean, you can stop talking to him or unfriend him on Facebook. But if you get this information from a licensed agent and they mess you up, you can get this fixed. So it doesn't have to be me, but find someone you can get advice with, someone who is licensed and has been doing this for a while and will guide you in the right direction. Okay, let's talk about part B now. Part B is doctor services, outpatient medical and surgical services and supplies, diagnostic tests, dialysis, outpatient therapy, some preventive health care services. And if there's anything that you don't remember anything today, the one thing I want you to remember is this one: medically necessary. I know everybody's not here talking, but if I came to people, what would they say was something that's medically necessary? Um, it's really something that if you don't get care for something bad can happen, or, you can die if you don't get the medical necessary that you need. I'm telling you guys this because your doctor that accepts Medicare signs a contract with Medicare and is required to tell you if something is not covered by Medicare. Okay, so I put this in your folder. I know everybody, I don't know if everybody has it with them, but it just really, what on page 2 of the form that I sent to you guys, it's really like what affects Medicare coverage. I'll break this down to you. If something is not covered by Medicare, your doctor, wait a second, now your doctor gives you this. If something's not covered by Medicare, your doctor has to tell you this. I mean, it's something that they need to sign. The first question, and they're going to have to send you a form that's called Advanced Beneficiary Notice of Non-Coverage. Okay, your doctor is required to give you this form that if Medicare is not going to cover it, they're going to let you know that, they're not covering it. And the first thing that states that Medicare is not going to pay for this. The first thing that, if your doctor takes this out and tells you to sign this, the first thing I want you guys to ask your doctor is, really, why are we doing this? Because if it's not covered by Medicare, it's not medically necessary. And I want you to ask your doctor, why are you going to do this? And the reason why I'm telling you this is because we see this all the time. This gives you the opportunity to opt out of this. And I'm not, look, if you want to pay for something, that's fine, but don't let your doctor spend your money. Okay. It's something just something that gives you guys a little bit of a information on your side of leverage saying, look, don't let them, just because we've seen people where they sign this and all of a sudden they're getting $3,000 bills before a medication or an operation. If Medicare is not going to cover it, first thing, just make sure you tell them, well, why are we doing this? And like I said, if it's something you guys want to pay for, that's your choice, but just don't let them spend your money. Okay. Now, Part B, and this is a big one for people, and this is really where people could get themselves in trouble with Medicare. 2024 deductible is $257. Um, Medicare generally pays 80% of approved charges. Part B co-insurance is generally 20%. So we're all used to an 80-20 split with a max out of pocket. But the big thing is Medicare doesn't have a max out of pocket. So 20% of what? So if you get $1 million bill, okay, you're going to have to pay $257 a deductible, and then you're going to have to pay 20% of $1 million. That's $200,000. Okay, and this is where a second supplement comes into play to fill in those gaps. Okay, so a lot of people don't understand that. That's a big part of supplements. You can get a Part A, a Part B, but then you're going to have that exposure to 20% with no max out of pocket. And that's where a supplement comes in. Okay, and these are things we're going to go over in a few. Okay, now initial enrollment. Part A is typically automatically at no additional cost, 1 to 3 months before your 65th birthday. Now, the big thing is your coverage starts on the first of your birth month. Now, if your birthday lands on the first, let's say your birthday lands on February 1st, your coverage is going to start January 1st. Okay. So you're going to get a free extra month. If your birthday's, the second, third, it's going to start on the month of your birthday. So if it's February, it's going to start on February 1st. General enrollment for Part B, generally January 1st through March 31st each year. Coverage effective the first of the following month. Premium increase is 10% for each year you're eligible and did not enroll. Okay, so what that means is if you didn't enroll in Part B when you're supposed to, and you wait 2 years or 5 years, there's going to be a 10% increase on your premium for the rest of your life. Okay, this is where a penalty comes in. This is where we try and help people out that unless you have credible coverage, meaning that like an employee coverage, if you have that, then you don't have to enroll in Part B. But if you have no coverage when you're turning 65, this is something that you need to have. You have to take advantage of this and make sure that you're enrolled. And that's where we try and come in and help people out. So you're not getting, because let's say if it's 65, you don't roll into Part B. Oh, I'll wait 5 years. Well, you're going to have an increase of 50% for the rest of your life. Okay. And
So are
Part
you
C,
saying any sort of insured? So like for me, I'm self-employed, and I pay insurance, for myself. Would that then turn into
now where you
a
getting
B
this insurance from? The marketplace?
right now until next
Yeah,
year?
you're going to need credible coverage. You're going to if you have an employee coverage, that's a different story. But if you're turning 65 and you're on marketplace, you're going to have to roll into part A, Part B. Yep. They don't do it with marketplace. And this is a special enrollment too. Like I said, if you're a Part B, sign up within 8 months at the end of your employer or union group health plan coverage, no increased premiums. Okay. So you need to have credible coverage. Okay, next one. Coverage preventive. This is really, these are screenings or to really help prevent something from happening to you. Because you rather find out, if you have a health issue at the beginning stages than to find out before it's too late. So just like cardiovascular screening is usually every 5 years. But if you have a heart issue, they may require you to be checked every year. And because your doctor thinks it's necessary, so Medicare will pay for it because you have what's called a medical necessity. So just things that you need to do, or vaccinations like, shingles, something that they will cover. Anything that's really going to make sure that you don't get worse. You know, even like colonoscopy, if you have to drink that fluid, they find out that there's a polyps or something like that. Instead of seeing you every 10 years, they might make you do a screening once a year or every 5 years. Okay. Not covered under Medicare, dental care, vision services, not routine ones for vision, but Medicare will cover for like diabetes or cataract things that can affect your vision, acupuncture, cosmetic surgery, chiropractic services, long-term care, they're not going to cover. Now, physical exams, they don't do for an annual physical exam, but when you first go onto Medicare, they do give you one. It's called Welcome to Medicare Physical Exam, and it's a one-time service, and you must get it done within 12 months when you go on Part B. Okay. And Medigap supplement policies sold by private insurance companies to fill in the gaps in original Medicare plans. Just to let everybody know, and you must follow they're all being regulated, federal and state laws, not the same as Medicare Advantage plans, must be enrolled in Part A and Part B. Now, the plans A through G, K, L, M, and N, people really focus, the biggest ones that we really kind of focus on is really Plan G and Plan N. They have the most coverage, no excess, you know, expenses. Like if you're in a hospital and Medicare, you know, covers certain doctors, but you have a specialist that comes outside from the hospital, they might not cover all the expenses. So if there's any excess expenses, things that you're going to have to cover. But Plan G, just to kind of let you guys know, just for an example, all the plans are the same. Whether it's a Plan G, a Plan N, doesn't matter who you go through, whether it's Humana, Aetna, Mutual of Omaha, a Plan G is a Plan G. Just to kind of put it into a better perspective, ladies or guys, if you go shopping for a blouse or a shirt that you really like, and Belk has it for $60, and Dillard's has it for the same blouse, same shirt or blouse for $80, you're going to buy the one that's cheaper. It's the same shirt, just different prices. That's really kind of difference. The only difference, like I said, is going to be price and difference with the companies, but all the plans are the same plans. They're all standardized. And you can switch anytime from any supplement, anytime throughout the year. Here's the big kicker, though, with the supplements plans. When you first go onto Medicare, you are guaranteed to be issued. Okay, they cannot deny you. Doesn't matter if you have any prior health issues, cancer, anything like that. Once you're going on to Medicare for the first time and you sign up for a supplement plan, you're going to be approved. Okay, so so we go back and you listen to Bill, who's your neighborhood expert, and you got on the Medicare Advantage plan, and you find out after a few years that you don't like it and you want to go back to original Medicare and get a supplement, well, you're going to have to go through underwriting and they might not accept you. Okay, so then you're going to be stuck on the Medicare Advantage plan. So that's why what we recommend is when you first start, at least start with a Medicare supplement plan. Okay, because you're going to get coverage, it's going to be guaranteed, and if you don't like it, then you can go to a Medicare Advantage plan. I think they even give you, if you wanted to try it out, I think they give you like a full year just to kind of try it out. And if you don't like the Medicare Advantage, you can go back to supplements. Okay. Also, too, customer service. Okay, who likes calling a 1-800 number? Nobody. Okay, you're calling a stranger. They don't care about you. They have no invested time into you or interest. But for the same cost, you can have a personal agent, someone who is local you can sit down with, who gets paid through the insurance companies to take care of you. So let me ask you a question. Who do you think is going to work harder for you? Option one, a 1-800 number, or who you never met before, or somebody like an option two, somebody you sat down with, somebody you have a relationship with. Okay. And look, like I said, not saying that it has to be me, but make sure that you find somebody that can help you. Okay. Because it's important. Okay. Medicare Advantage plans. The industry wants me to sell you this plan. How do I know that? Because we get paid almost twice the amount compared to the supplement plans. These are local and regional, HMOs and PPOs, which means if you go to New York on vacation to see family, does it work there? Only in an emergency. Okay, so if you're somebody who's traveling, it might not be the greatest plan for you. Here's the other thing. With the Medicare Advantage plans, we have a few clients that we work with that used to work in these claims departments for these companies, and they were actually instructed to find a reason to deny claims. So when you hear on TV that 50% of claims with Medicare are not approved with this plan, this is what they're talking about, the Medicare Advantage plans. You have to understand these are multi-billion-dollar companies, okay, who have stockholders. So they need to be profitable. So for them, they're going to look into more than medical reasons on whether or not your claim is paid, and that's cost. Okay, so we don't recommend them because we feel that they can hurt people. But if you want one, we'll sell you one. I mean, we'll have another conversation, but like I said, we recommend going on a supplement first before you go on a Medicare Advantage plan. Okay. This is just all right. So I'm just trying to make it easy for everybody and get everybody through this. So I don't want to take too much time because I know Zooms are different than sitting down with people face to face. So medical Part D, original prescription drug plans, started back in 2006, offered through private prescription drug plans, can be offered by Medicare Advantage plans. Eligibility must be on Part A and or enrolled in Part B. Enrollment is voluntarily, but just like Part B, where there could be a penalty, same thing with a Part D. Increased premiums for people who wait. 1% of the base premium for each month you don't enroll. So really kind of what we tell people is you got to kind of work the numbers. If some people don't take prescription drugs, some people feel they don't need them. The only thing is if you wait 5 years, I mean, you're going to be paying almost a 60% increase on premiums. So the only thing we can tell people is just do the numbers. It's up to you what you want to do. It's voluntary, but the only thing is if you find out 5 years later you want a prescription drug plan, 12% a year times 5, I mean, you're going to be looking at a 60% increase on the premiums. Okay. And that's really about that. And enrollment. Okay. And this is a big thing for us. And this is what changed this year on the drug prescription plans. To join is between October 15th to December 7th. Coverage will begin January 1st. Join 1 to 3 months prior to your birth month. Coverage begins the first day of your birth month. Join 1 to 3 months after birth month. Coverage begins the first month of the following enrollment. Due to the Inflation Reduction Act, the insurance companies cut our contracts this year. So we are no longer legally allowed to sell anybody prescription drug plans. So if you want one, you're gonna have to learn how to enroll yourself. Also, there's what's called an ANOC. That's on the bottom, which an annual notice of change. Your plan is going to change every year. Doesn't mean that you're going to have to make any changes, but the only thing that we do ask is just at least review it. You're going to have to go to medicare.gov, put in your prescriptions and choose a plan. But if you guys are dealing with us for the first ones, we will help you guys do it, get you guys enrolled. Because like I said, we're doing prescription drug plans for years. I mean, they cut all of our contracts, everybody that we've been dealing with. Now they're not paying us at all to do this, but we will help you guys out if you guys have any questions, but we just can't shut down the office and have thousands of clients calling us and getting this done. So if you guys do have problems, give us a call, but we do send out flyers like every couple of months just to let people know how to enroll and stuff like that. And if, like I said, if you guys want the slides, I'll send them out. If you guys have any questions about the enrollment, stuff like that, I'll go over that with you as well. Okay, and how it works. course, 2025, you pay 0 to $590, you pay 100%, $2,000 initial coverage. Member course could be 50% payment, and after $2,000, you pay 0. Now, this is just on covered prescriptions. This isn't all generic stuff like that. So you got to make sure these are covered prescriptions, because that's going to be a big difference on the prices. Okay, and any questions you guys do have, I mean, you guys can definitely go to Medicare.gov. If you guys want to be confused, you can call 1-800-Medicare. Even if you do call them, just to kind of let you guys know, they're going to be doing the same thing that you can do. They're going to go to Medicare.gov and pretty much look up any questions people have. You can also go to what's called SHIP. In North Carolina, SHIP.com. These are Seniors Health Insurance Information Program. And these are all volunteers. So they're there to help you. They're not there to sell you guys anything. And that's pretty much it. I mean, the evaluation form. If you guys, just remember our fees are nothing. It doesn't cost you anything to meet with us. If you guys want to come to our office, if you want us to sit down with you guys, we're here to help you guys out. Okay. I
Does
know you guys
anybody
wanna-
have any questions or further questions?
I haven't done a Zoom call in a long time, so I felt like I was
Yeah.
a little off on that one, but I'm not.
Are you trying to, I think Leslie has a question.
Yeah,
There she
I
goes.
can't see you guys. My only question is, my birthday is April 5th, and you had mentioned enrollment October 15th through 12/7. Should I be enrolling before January then for an April 5th birthday?
Yeah, I mean, we kind of tell people to enroll earlier than later because you can lock in prices where they're on now. The only thing is, if you wait, prices could increase. Comes the new year. So we definitely and it's just things to take off your list, stuff like that. So, I mean, are you currently working now? Are you retired?
Retired.
You're retired. Okay. You're turning 65, or you are 60? Are you
I'll turn 65 in April.
in April? Okay.
Yeah.
Yeah. I mean, usually 7 months before your birthday, is the time to start looking into it, getting everything prepared. Are you collecting Social Security now?
No.
Okay. That's something you're definitely gonna have to sign up for. I would definitely go to ssa.gov and sign up for Social Security. And you're gonna have to go to Medicare and enroll into, Part A and Part B.
Okay.
Okay. Like I said, if it's I mean, I know this is being recorded, so I don't really want to kind of get into people's personal
Yeah.
information. So Leslie, if it's something you want to talk about after, I mean, we are here to help you out, and we look to build relationships with people and sit down with you guys.
Okay.
And
Okay.
we
So
will send you the recording, Leslie, so that you have it along with the supplements he discussed and the his information.
yeah.
Okay.
Yeah, and I did include an evaluation form. So if there's other things that you want to talk about or anything that you do have questions, or if you guys do want the slides, we can send you the slides as well.
Okay.
Okay. But we're here to help everybody make make Medicare easy for everybody. And
Yeah.
that's really kind of, like I said, I mean, you could go to your insurance company, you're just going to give money back to your insurance company, but for the same price, you're going to actually get somebody who's local, somebody you can sit down with and make sure
Right.
what you're doing is going to be the right fit for you guys, because the biggest fear people have is really making mistakes.
Right. Okay.
So, but we're here to answer the questions or concerns that you guys have.
Yeah, because I don't really want to take Social Security yet.
Okay. Okay. I mean, we could still, it won't be automatically, you won't be automatically taken out of your Social Security as far as your money. But they'll probably send you a bill every 3 months. Okay.
Right.
'Cause that's where most of the money, like when you sign up for Medicare, they take it automatically out of your Social Security. So if you're not
Yeah.
going to be
So it
on Social
doesn't matter.
Security,
It would. Okay.
yeah.
So it
and
doesn't
that-
matter. It's not more or less money. It's
No,
just
they'll
how
just send you,
how
yeah,
it's
they'll
paid.
just send you a bill every quarter.
Mhm. Okay.
Okay. Like I said, something if you want to sit down, we'll sit down with you and go over everything and make it easy for you.
Okay,
Okay.
sounds good.
Okay. Okay.
Would you advise people who already have Medicare to sit down with you? Because if there are any changes that might be coming up for next year with the new
Well,
bill?
I know Aetna might not be around in North Carolina very soon. So some people who are signed up through Aetna are going to have to find a new plan through the Advantage plans. Also too, if people are on original Medicare, maybe they want to try different plans instead of being on a plan A, maybe they want to go to a plan G or a plan N because maybe they found out throughout the year that they get a lot of co-payments, deductibles. You got to kind of work the numbers. I mean, that's really what it comes down to. Because some people don't see doctors that much, so some of them aren't going to have co-payments. But if somebody's seen doctors more frequently than somebody else, co-payments can definitely add up very quickly, or even deductibles.
Okay. Well, thank you, Greg. Anybody else have any questions? Okay.
Come on, you can't make it that easy for me. There's got to be more questions.
Yeah.
But just seriously, anybody who has questions, like I said, we're right here in Wilmington on Market Street. We can come to you. You can come to our office, whatever is more convenient for you guys. And we're here to help you guys out and make sure that you're making the right decisions.
Well, thank
Right.
you.
Okay.
Have a good day, everybody.
All right. Thank you,
Bye-bye.
All
guys.
right, thanks.
Bye-bye.
Appreciate it.